Right. Let us begin our session with Kitab Al-Fatihah. Okay. I should have two lectures with you, isn't it? The one is communication and the other one is nutrition and growth. I think let us do the communication bit first, and then is Friday still on? Friday we still have another session, isn't it?
Yes, Doctor.
Yes, Doctor.
So tonight we'll do the communication bit, and then on Friday we'll do the nutrition and growth. Okay, let me show. All right. Can you see the slide?
Yes, Doctor.
Yes, we can see it.
Okay. All right. So this is a new topic that I think we only put in the teachings. I think I would say earlier in this year. Before this, we haven't got this topic like in our teachings. You know, one thing that we noticed, because you all are part of the new punya ni kan, new punya academic, new curriculum. So with the new curriculum, you will have this the man OSCE stations. So this man OSCE stations apa semua, there's a lot of communication component, and we noticed that as well. Many issues with medical legal actually arises with poor communication, and I think among the major problem with doctors is actually how we don't communicate well with our patients and so on and so forth. So that is why we think having a proper communication teaching for year 3 and year 5 is actually very important. Okay, all right. So the first thing I want to highlight to you all is children are not small human. The thing is, many of us we perceive children as just homunculus, just a miniature human being. So we treat children as the same. No, they are not just small humans. They are not just a miniature adults. They are not adult in smaller size. They are not adult in bits and pieces. No, they are by themselves. They have different physiology, they have different developmental capability, they have different functional capability according to different ages. Even what type of bug that can infect them are different. Children who are newborn babies, they are the common organism that infects them are different types of organisms. Children less than 60 days old, different types of organism. Children less than 1 year old, different types of organism. So even among children, they differ. So they are not small human. They are not miniature human. They are not just a homunculus. They are different by themselves. At different ages, they have different cognitive capabilities. So this different cognitive capability actually will affect how we should communicate with them. They have different motor and speech development. How they can understand speech will differ according to the different stages. How they communicate themselves will actually differ. For example, they can only okay, they can only understand they can respond with smile by after 6 to 8 weeks. Before 6 to 8 weeks, yes, they can smile, but it's not they just smile for whatever reason. So after 6 to 8 weeks, they can only then they can have social smile. So when social smile, they will smile on cue, smile on response. Then after 8 to 10 weeks, then they start to laugh and so on and so forth. So different stages. But it doesn't mean that we do not talk to them. We do need to communicate properly with them. And again, different upbringing affects how they communicate as well. For example, I give a simple example. uh, people in Asian parts of the world, people in Malaysia, for example, we are not we are not as outspoken, we are not as verbal as children brought up in Western countries. I saw even Malaysian children who are brought up in UK, for example, how they communicate is different as compared to children who are brought up in Malaysia, because how is the upbringing. So in Malaysia, we cannot speak louder than adults. For example, there's many cultural aspect that is involved in how we communicate, and then we see how other parts of it's not just one type. You compare between Indian, Chinese, Malay. So all this have different because our upbringing it's not actually our race, it's actually our upbringing. A race just shows our color. Genetically, we are not that different. Our snips may be a bit different, but it's just the color. The issue is how we are, how is our upbringing. And then parental expectation as well will affect how they communicate with us. So when we communicate with children, when we communicate with the parents as well, we need to look into these issues. And again, when we see children, it's not just the matter of, okay, among the problems that I saw with students is that when they meet children as the patient, they communicate mainly with the parents and they totally ignore the child. So that is a problem as well, because the child, even though the child is small, even though it is a baby, yes, we do need to speak with the parents, but we need to acknowledge the child as well. Because the child, even though the child is a baby, they have their own feeling, they have their own understanding, and so on and so forth. So we need to acknowledge both the parents and also the child themselves. Tak boleh juga kalau kita focus too much on the child. Kita examine the child, kita focus on the child solely without even acknowledging the parents. So in pediatrics, we need to acknowledge both the child minder, and also the child themselves. Okay, all right. Next, newborns are still to be communicated with. This is what I've said before. Sometimes we see newborn babies, kan? Yelah, kita faham lah dia tak boleh cakap, and they don't really understand what you talk to them. And then many of us don't communicate with this newborn. So, and I see this as a neonatologist, I see this as a problem. Because newborn babies, yes, if you speak to them, they don't understand, but they can acknowledge your feeling. They can understand the social cues. Yes, they don't reciprocate by giving you the they don't reciprocate the whatever emotion, whatever understand, whatever feeling that they try to communicate to them, but they do understand. They have their feelings, so they respond to social cues. So smiling even to babies have its own effect. They can understand the different intonation in your voice. So newborn still needs to be communicated with. They can understand, they can appreciate voice. Studies have shown babies, ill babies who are exposed to rhythmic sounds, macam Quran, tilawatil Quran, macam uh, classical music. So some of them, they respond better, they get better much earlier, and they respond well to parental punya voice. So ill children, I always advise ill parents, if your baby is unwell, one of the best thing to do is you go and speak to your child. Kan duduk, bila parents datang dekat our NICU, I ask them, go and speak with your child, hold your baby and communicate with them, because children, newborn babies, they respond better when people communicate with them. And then read to them. This is one thing as well. This is one thing that I've been trying to inculcate in our NICU, because studies have shown newborn babies who are being read to, dibacakan buku pada dia, kita read to newborn babies, they have better literacy rate as compared to other babies. Understand language much faster as compared to other babies. So reading books to your newborn baby is extremely good. But it is not done in Malaysia, because in Malaysia, even bigger child, we don't read to our children. That's the problem. And so we need to read to children. Okay, when you communicate with patients and the parents, uh, communication session, it can be for so many reasons. It can be because you want to, for medical students especially, you need to clerk the patient, for example, kan, you nak dapat history. Or in your exam setting, that is an interview session. It's still a communication session. Or you ada result, blood test result, you nak kena inform the result. Ada patient datang dengan you have a new diagnosis, you need to discuss about the diagnosis, or you need to discuss about the plan of management, so on so forth. Or it can even be a session about palliative care. So the child is dying, for example. So that it's any session that you are going to meet a patient or a parent, it should be a interview, and it should be a planned session. It should be planned. It should not be abrupt. Okay, fine. Sometimes ada patient they interrupt kita. It's an abrupt session, but you still need to plan whatever you are trying to say. So ideally we need to plan the session. So how to plan? The first thing is you need to have clear objective. You need to know what is the purpose of that communication session. What is the purpose of you meeting them? Is it to get history? Is it to get is it to for you to relay information, or is it for you to assess the understanding of the child's disease? So what is the objective of that session? You need to have clear objective. Dia tak boleh ada session macam lalang tu nak jumpa parent. No, tak boleh. You kena ada clear objective. What do you want to try and achieve with that session? And then it should include appropriate personnel. So who do you need to be with you? Do you need is it okay for you as a medical student, or is it okay for you as a doctor to be there with the parent, or do you need someone else? Do you need surgeon to be with you if the problem is has some surgical element, or do you need the ENT, for example? The child has laryngomalacia, you need ENT to be with you to discuss the plan and so on and so forth. Or do you need physiotherapist? Do you need speech language therapist to be with you? Do you need occupational therapist? Do you need dietitian? Do you need nutritionist? Do you need community pediatrician to be with you? Do you need the nurse to be with you? Most of the time we need the nurse to be with us because nurses have better rapport with the parents, for example. and then it's good thing to always have someone else to be with you, because sometimes parents can sometimes you may speak something else, parents understand something else, bila kat luar they actually say something else. This is what happened dengan yang recent case yang doktor kena saman kan. So what they speak to the parents, what documented in the notes is different as compared to what happens outside. So sometimes it's good to have a witness to be with you, and among the best witness to be with you is actually the nurses. So which personnel you need to be at that particular time? Do you need language people? Do you need someone that can translate for you? Because sometimes, like for example, last week we have a patient whose parents are from Rohingya. They don't speak Malay, they don't speak English, they don't even speak Arabic. I don't know what language they speak. So do we need someone else to actually translate for us? Do we need translator to be with you? So who you need to be with you? You need to plan this. Or do you need someone more senior? Sometimes you want to communicate something. For example, there's an error. Sepatutnya bagi ubat ni tapi terbagi ubat lain. Sepatutnya bagi ubat ni at this particular dose, accidentally given a higher dose. So you need to counsel the parents that an error has happened, for example. So you need probably a more senior personnel to be with you. You need a consultant, you need to have a more senior matron, for example, to be together with you in that particular setting. So which personnel do you need to be with you? And sometimes I've had one case dulu. Father dia baby lah. Father dia very macam mana cakap baby ni ada tracheoesophageal fistula. Baby ni ada tracheoesophageal fistula with esophageal atresia. Maknanya dia punya esophagus dia doesn't continue until the stomach. Dia ada blind end. Lepas tu dia punya esophagus dengan trachea dia ada connection pula. So you tak boleh start feeding. Kalau you start feeding, feeding semua akan masuk dalam dia punya lung lah.
Yes, sir.
Kan? Someone trying to say something. Is it? Anyone? You were trying to say something? No.
No.
Okay, all right. So, so this patient had this problem. This baby was born with this particular problem. What does the child need? The child needs surgery. The child needs surgery because without surgery, the child cannot live. The child cannot feed. The child cannot go anyway. The child needs urgent surgery. But father strongly refuses. Bapak dia bomoh. Bapak dia tok bomoh kampung. This is a real case. And father really strongly against surgery. Even nak put line on the baby pun, the father almost got into an argument, almost quarrel lah, nak bergaduh dah. And few times kita terpaksa panggil security untuk clearkan father dia. So it was quite a scary situation lah. And then dekat Kelantan pula, dekat dengan Thailand, Tok Bomoh, you don't know what's gonna happen lah kan. Semua my staff pun semua macam takut. Dia takut bapak dia bomoh ni buat apa-apa benda kan. Tengok gambar dia jampi-jampi apa kan, problem. So everyone is a bit scared. So apa nama, even each time, sebab kita ada kamera kat luar, so each time bila parents dia sampai, kalau kita nampak father dia, kita kena make sure security nearby. Kita kena make sure ada doctors yang male doctors with us. Kita kena make sure with the child tu mesti ada few other extra personnel, kan? So you need to plan which personnel you need to have with you. Sometimes you do. I've had several sessions where when we meet parents, we need to have security together with us. So kita kena prepare what type of personnel that we need with us. I've had another case masa dekat UK dulu. This is a child with actually brain dead ni child lah. Brain dead ni child. Baby ni was born, dia ada abruptio, dia bukan setakat abruptio placenta, dia ruptured uterus. So ruptured uterus, mother dia ada one previous scar, so went into labor, uterus dia ruptured. Uterus ruptured, baby dia went out, keluar daripada uterus tu. When they did cesarean section, baby tu dah keluar. And baby was born in a very poor condition lah. So baby was actually pronounced brain dead already, tapi still surviving on the ventilator. Isunya adalah parents dia saman hospital. Parents dia saman hospital. Not because poor care, it's just because parents insist nak bawa baby dia go to other hospital. Kat UK everything is paid by NHS lah kan. And they free, government yang bayar. So dia insist nak bawa baby dia yang dah brain dead ni untuk pergi Italy, for example. So that's a problem lah. Sebab siapa nak bayar? Ventilated baby, siapa nak transport apa semua, that's very difficult punya benda lah. So parents then sue hospital, sue NHS. So each time we meet the parents ni, kita kena ada someone senior and ideally hospital punya legal team. So the thing I want to highlight to you is you need to think who you need to be there with you in that particular setting. Or do you need the session to be only you alone? Sometimes you don't need anyone else. You need just you. And you need to remember as well, not just us in terms of the medical team. Who do you need to be with you in terms of the patient? Sometimes you do need to speak with just the patient. Sometimes you need to speak with just the mother. Sometimes you need to speak with just the father. We've had cases before in our hospital yang mana father gave different history, mother gave different history, grandmother gave different history. So who do you need to be there with you? Sometimes you do need to pray and get more information because sometimes they may have different understanding. It's good to have different, and then you summarize kembali. Yeah, so who do you need to be with you from your side and from the parental side, appropriate personnel, and it should be a scheduled time. Schedule time maknanya you need to plan. Okay, kita jumpa session pada hari-hari berikut pukul berapa. And you need to make sure that bila you plan, bila it's schedule, so it will be a time that you are sure you are not busy. Tak boleh lah you buat session, tengah-tengah tu you kena cover NICU, you kena buat ni, you kena buat tu, ada apa semua. So you ada teaching, ada macam-macam. So you can make sure that at that particular time you are available and you won't be disturbed so much. So schedule time. And then preparation. You need to prepare for the session. You need to prepare. You need to have adequate information. Adequate information in terms of what are the things that the parents want. Do you have enough information about the disease, for example, or do you have enough information about the treatment and so on and so forth? Do you have enough personnel that you need to call? What are the questions from the parents? What are the concerns from the parents? Okay, setting. So you need to, what is the ambience of the session? You need to have a proper privacy, because sometimes when you counsel certain things, parents, they may cry, for example. When you counsel that the child is dying, for example, they may cry. So you need to give them a space for them to cry. You need to have a space for them to be together by themselves, for example. So privacy must be, you tak boleh you cerita pasal satu masalah pasal patient, semua orang boleh dengar. Tak boleh juga macam tu. So it needs to be a privacy setting where only the people that needs to know will know about the problem. You tak boleh cerita macam ada patient yang you buat HIV positif, for example. You tak boleh lah counsel semua orang dengar. Kan? Dia kena certain people saja boleh dapat that information. Sama juga even like COVID. You tak boleh cerita pasal COVID, satu hospital tahu patient ni COVID positif. Tak boleh. So only certain people need to know. So you need to have a proper privacy setting. The setting must be they must have a privacy. It must be comfortable. The setting must be comfortable. Kalau dia nak cry, dia ada tempat dia boleh cry, dia boleh duduk dan sebagainya. So you tak boleh you nak counsel pasal a dying child, for example, you tak ada kerusi untuk dia duduk. Ataupun kerusi tu kerusi jenis yang ada tayar, tak stable, kan? So takut kalau dia jatuh, so you kena create the setting must be comfortable for you and for the parents. And then sometimes bila kita sit, for example, kita jangan sit in opposite direction. You don't macam duduk depan ni, patient duduk depan, opposite. Sometimes it's good if you do in like 90 degree, or you are by the side of the patient. Sebab apa? Sebab sometimes, especially when you are speaking about benda-benda yang heavy, benda-benda yang emotional, when you sit in opposite direction, it tends to give the vibe that you are in opposition. So if you are by the side, it gives the impression that you are with them rather than you are against them. So these are all things that affects the subconscious mind. And so make sure it is comfortable. Sit properly, ideally in a 90 degree or by the side of the patient. Don't actually go at opposite direction, for example. And then the setting must suit the purpose. For example, if you want to counsel about how to do resuscitation at home, kalau baby they collapse, for example, macam nak buat resuscitation, you don't need the baby to be with you. You need a setting where you have a mannequin for you to show macam nak buat CPR, macam nak buat apa semua, kan? If you wanna discuss about feeding, macam nak feed baby, macam mana nak handle baby tu, you probably will need the baby to be in the setting. So probably you need to do it by the bedside supaya parents boleh tengok, okay, yang ni feeding tube dia, ini nak buat apa. So do you need the session to be by the patient, or do you need the session to be somewhere else? So the setting must suit the purpose. If you need paper, if you need to draw, for example, if you need x-ray, you want to show baby ni ada pneumothorax, you nak kena buat chest drain, probably you need a setting where you have the x-ray viewer with you, supaya parent boleh nampak these changes. So this is the pneumothorax, for example. You nak counsel baby dia ada severe IVH, intraventricular hemorrhage, probably you need the setting where you have the x-ray viewer together with you. And so the setting, it must suit the purpose. It must suit the purpose of the session. It must have appropriate room and appropriate equipment. Kan kalau you nak ajar resuscitation, kena ada lah mannequin dia, kena ada benda-benda dia semua. And it should be no disturbance. Tak bolehlah kita kejap ada alarm, kejap ada ni, kejap ada tu, bilik rasa panas dan sebagainya. So it must be appropriate. It shouldn't have any disturbance. Okay, so when you start the session, always begin with introduction. So introduction first, of course lah, salam dan semua. One of the things that you need to do is this. I saw many students always lupa benda ni, especially in your setting, your exam nanti, man or ski, always begin with introducing. Introduce yourselves, who you are, why you are there, and who are together with you in that setting. Kalau ada lecturer, beritahu this is lecturer, this is apa. So introduce everyone that is present, kan? And expect them to introduce themselves as well. And then bukan setakat bagi tahu nama, you need to explain the role. What is the purpose of this person here? What is the role of this person here? Apa role masing-masing yang datang in that particular session. And get consent. Bukan written consent, at least okay. You macam contohnya okay, saya doktor, saya medical student, kalian datang untuk exam, ini lecturer saya, dia akan tengok macam mana performance saya pada kali ini. So kali ini kita akan mulakan sesi untuk perbincangan. So you ask them, okay, kali ini saya nak tanya beberapa soalan dan saya nak periksa anak, boleh ke? So you ask consent for that session. You ask consent, okay. For example, if you have a session, if the task is actually to counsel, ini selalu masuk man or ski. Contohnya you ada result, ada patient admitted dalam ward, result shows that the child has diabetic ketoacidosis. So you want to discuss about the result. So you after you explain siapa ni, what is everyone's role, you bagi tahu, okay, hari ni datang ni, saya panggil kali ni sebab ni ada keputusan darah yang kita dah tengok dan saya nak bincang pasal keputusan darah ni dan nak tengoklah, nak pastikan mak pun faham pasal penyakit anak ni supaya kita dapat bantu perawatan dan sebagainya. Okay ke? So get consent for that particular session. And then ascertain the objective. A certain objective ni you need to make sure that all attendees must know the purpose of the session. So bukan you seorang je tahu what is the objective of that particular session. Semua orang kena have the same objective. Semua orang tu siapa? Semua orang yang attend. Contohnya if you call occupational therapist, if you call, kalau patient diabetes kan, you panggil dietitian untuk join together untuk explain pasal diet dan sebagainya. So everyone needs to understand, everyone needs to have the same objective, everyone needs to have the same purpose, not just your side, the parents also should have the same, should understand the same purpose of the session. Bila semua have the same objective, baru you boleh clear, baru you tahu mana nak pergi. Okay, so okay, awal-awal boleh beritahu, okay, hari ni ini purpose kita. Kali ni kita ada masa dalam dengan sejam, ini yang kita nak capai. Okay ke? Boleh ke? Ascertain the objective. Make sure semua orang faham. Bagi tahu awal, okay, petang ni kita nak discuss pasal ni. So biar parents pun tahu, biar fokus. Sebab you cannot settle everything in one go. You cannot discuss about everything in one go. You need to have multiple sessions. So but for that particular session, everyone should have the same purpose. Okay, know the background. Know the background, know the background of all the attendees. So you need to know the background of the parents, parents patient. Apa language yang dia guna. Tak boleh lah you main panggil apa semua. Sekali dia tak faham cakap Melayu pun, tak faham cakap English. You need to have someone that understand the language. Dan someone tu you tak boleh panggil patient lain. You kena panggil a proper translator, kan? So background of the thing, what language, what level of education, kan? So kalau you have patient yang doktor, you tak boleh cakap macam orang kampung. You kena counsel in a proper professional medical level punya language lah. Tapi kalau parents tu contohnya orang asli yang kerja odd job je, tak sekolah pun, you cannot give the same language dengan jargon-jargon dan sebagainya. You kena tone down your counselling session tu, kan? If you have patient with so know the background, kan? Teacher, lawyer, all this will affect how you going to communicate, because Nabi pun katakan khatibun nas ala qadri ukulihim, speak to human based on their level of their intelligence, kan? This is what the prophet told us. So, sama juga dengan in our work as medical personnel. We need to speak to people according to their level of understanding, level of knowledge, level of education, and so on and so forth. So assess their background. Not just that, not just the parent, the patient, also the background of those people that you call to help you. Kan? Kalau you panggil dietitian tu cakap Arab je. Kan? Tak settle juga. Kan? So yang datang dengan you tu, you need to know their background as well. Kan? Apa dia punya preference, apa dia punya understanding a bit. And then level of prior understanding. So before you start, kan, you dah bagi tahu, okay, hari ni mak kita nak discuss pasal diabetik, pasal anak ni ada result ni. Okay, kita nak bincang. Boleh ke? Okay. Dah dapat consent. Kan, you dah inform purpose. Purpose kita nak discuss pasal result ni dan kita nak tengok macam mana kita nak pergi proceed dengan kita punya rawatan dan sebagainya. And then assess dia punya understanding. Okay, saya dah assume anak dah masuk beberapa hari. Mesti dah ada ramai doktor dah pernah cakap dengan mak. Okay, apa yang mak faham pasal penyakit anak setakat ni. Assess dia punya prior understanding because so many people will have spoken to the parents about the particular problem. Of the specific problem. For example, assess what do they understand. Because if they already understand so much, then probably you can focus on much more detail, much more specific areas. But if they don't understand anything, probably you need to go a bit backward. Kan? So you need to go even back to history, back to benda-benda yang more basic things. Dan so assess their level of prior understanding. And then assess their expectation juga, apa yang parents expect daripada session tu. Do they expect to come into a conclusion of how to manage? Do they expect to have conclusion of how to settle everything? Or do they expect to just have a general idea about what the problem the patient have? So assess what is their expectation. Assess understanding. Assess prior, I've told before, assess the level of comprehension. How much the parents understand before. Baru you boleh go appropriately, ya. Kan? Sebab kalau cuba you imagine, you already multiple people have spoken to you about the same thing. How would you feel? You will feel irritated. You will feel bored. You're going to go to sleep, kan? So sebab tu kita kena assess what is their level of prior understanding. Use language accordingly. Language maknanya kalau you need language line ni by phone tu, hospital selalunya dia ada not our hospital lah. Dia ada phone line yang you boleh call yang ada banyak translator. Maknanya you cakap, you pass pada parents tu cakap dalam bahasa apa-apa yang perlu. You need language line. Do you need a translator to come to be with you physically there? Do you need appropriate personnel to speak to you appropriately with the appropriate language, for example? Kalau patient tu cakap Arab, for example, kan, you panggil lah doktor yang pandai cakap Arab. Ramai yang graduate daripada Arab countries, kan, datang. So to help you to translate, for example, use jargons where avoid jargons where appropriate. So sometimes you need to avoid using jargons. Tapi you tak boleh everything you nak translate into bahasa Melayu. You still need to use jargon appropriately. For example, you nak cakap G6PD deficiency. You kena cakap lah G6PD deficiency. You nak cakap jaundice, you jangan translate kuning semua, kan? So sometimes you need to use appropriate jargons accordingly. Kan? Tapi as best as you can, avoid using jargon. Use appropriate words. And then cover the concerns, because when you call the parents, when a parent have a child that's being admitted for whatever problem, they have their concern. Bila you panggil dia dah ada fikir dah apa concern dia, apa benda yang dia nak tanya. So ascertain what are their concerns, apa yang mak ayah risau, apa concern dia, and you need to assess and you need to cover everything. You kena settlekan, pastikan you have settled all their concerns. Tanya lagi, okay, ada apa-apa lagi yang mak risau, apa yang mak expect lagi, apa yang dia punya. Make sure that every concern is being handled. Walaupun you tak boleh settlekan, tapi you boleh janji, okay, next time kita akan cuba tengok area-area ni, for example. And then reassess understanding at every level. You cakap sikit and then you assess balik dia punya comprehension. Mak faham tak? Cuba cerita balik apa yang saya dah apa yang kita dah discuss sebelum ni. Bukan you kata, okay, cuba cerita balik apa yang saya dah cakap. No, bukan macam tu. Itu macam condescending pula, kan? Tapi kita nak apa? Cuba tanya, okay, kita dah bincang panjang. Cuba apa yang mak faham daripada apa yang kita dah discuss, kan? Bukan macam kita nak suruh dia parrot balik apa yang kita cakap tu. Tapi kita nak assess dia punya understanding. So at each level, Tengah-tengah tu kita tanya balik, okay, faham ke, okey ke, jelas ke ni, ada tak faham tak? Boleh cuba ulang balik apa yang kita dah discuss sebelum ni. Kan? And then formulate conclusion, always formulate conclusion. Okay, kita dah discuss dah pasal diabetic ketoacidosis ni. Okay, kita dah discuss diabetic ketoacidosis ni maknanya ni. So anak ni ada kencing manis. So kita dah discuss sama-sama tadi untuk rawatan dia, anak kena cucuk insulin. Lepas tu kena makan, kena jaga. So apa-apa yang you dah discuss tu, you buat conclusion balik. Buat balik conclusion. So balik ni, kena buat ni. Okay. Kan? Ini kita dah discuss. Mak setuju, kita semua setuju kan? Okay, boleh buat. So buat conclusion. Formulate conclusion balik. Kan? You assess comprehension, you create a conclusion. Buat sama-sama. Okay. Jom kita sama-sama, kita buat, kita dah discuss, kita buat rumusan sikit apa yang kita dah discuss hari ni. Buat sama-sama. Baru dia more meaningful lah. And more meaningful and impactful. Some important points. The first thing is empathy. When you have communication session with patient, you need to have empathy, especially when you talk about certain things that are emotional, certain things that are stressful, for example. And you need to show your empathy. Empathy tu maknanya you need to understand their feeling. You need to share their feeling. Kalau dia sedih, you kena appropriately show effect of sedih. If you tak boleh lah you nak cerita anak dia dying tapi you senyum, tone pun dengan higher pitch of voice, tone yang tinggi kan. Tak boleh lah macam tu. So bila benda sedih, you punya tone of voice pun kena slow, mood, you punya muka pun kena somber punya mood. Kalau ada background noise pun tak boleh lah you cerita pasal sedih, cerita pasal anak dia nak meninggal, background tu ada muzik-muzik, kelakar-kelakar, contohnya kan, ada orang gelak-gelak kat belakang. So tak boleh lah. So kena respect the session. So kena show empathy. Kan? So macam tu juga. So bila you cerita benda gembira, contohnya anak dah cure, for example, anak dia dah settle, dah ada leukemia dah settle, dah cure. Kan? So you tak boleh lah pula dengan nada yang sedih apa semua kan. So you need to be cheerful, for example. So you need, the emotion must be appropriate. And we always hear that as doctors, you shouldn't get emotionally attached to your patient. So that is true in some degree lah. So you shouldn't be emotionally attached to them, but it is okay for you to be emotional together with them. Contohnya kalau you explain anak dia dah dying, for example, mak dia sedih, menangis. It is okay for you to cry together with them, as long as it doesn't affect whatever you're trying to say, as long as it doesn't affect your clinical judgment and clinical acumen. So it is okay to be emotional together with them, as long as it doesn't affect your clinical judgment and clinical acumen. And you need to always show appropriate emotion and try to understand their feelings. Contohnya buat cerita bersedih, make sure that you have tisu semua ada nearby apa semua lah. Kan? And ada orang untuk touch. Touchy feely ni is very important lah. Okay, next is use open-ended question. So open-ended question, sometimes it's okay lah. Kita tanya, okay, apa mak rasa, apa mak faham. Tapi sometimes kita nak kena go close-ended juga. Tanya, demam tak? Ada tak? Not all the time kita boleh kata, okay, apa masalah? Sakit apa datang? So sometimes you may start with that, but you need to guide them to get the answer as well. Close-ended is important, but you need to use them appropriately. So open-ended question is preferable, but may need some close-directed questions if needed. And do not feed words into mouth. Mak ada demam ketar-ketar tak? So bukan you yang bagi words. Kan? You ask question, tengok dia jawab tak. Sometimes you do need to ask, but don't give the words. Anak masa ketar-ketar dia macam ni ke? Bukan you yang bagi term tu kat dia. Faham tak? So sometimes bila you yang bagi term tu, sometimes it may affect how they answer. So it's good if you try and get their answer first. Kalau tak dapat, baru you give options. Faham tak? So do not feed words. Jangan sampai dia answer tu sebab apa yang you cakap, bukan yang dia feel. Do not feed words into the mouth of the parents. Be a good listener. So only a good listener can be a good speaker. So always try and listen to what the parents are trying to tell you. I always tell my students, I always tell everyone, whatever the mother says is always important, but it may not be significant sometimes. So consider. So whatever the mother says is always important. So listen, listen. And the other aspect is non-verbal. So more than 70% of communication is actually relate by non-verbal punya communication skills. Verbal only accounts to 30%. Whatever I'm trying to say, actually 70% accounts from non-verbal. So non-verbal ni maknanya apa? Intonation. Kan? Bila benda sedih, lower intonation. Benda happy, higher intonation, higher pitch. The tone should be higher. Benda important, slower intonation. Benda less important, sometimes you may vary. Kan? Frequency, pace of your speech. Kan? Facial expression, benda sedih, you need to show facial expression yang sedih, for example. So facial expression is very important. Facial expression relays honesty. Facial expression relays trustworthiness. So facial expression is very important. Facial expression shows that you are a reliable and dependable person. So appropriate facial expression is extremely important. Body language, open body language. Bukan macam ni, you counsel pasal passion tu, tangan macam tu, close body language. Tak boleh. So you akan ada ni defensive body language. Kan? So you kena appropriate body language. Actually this session should have, they cannot face to face lah. Bila face to face, I'll show you what are the types of body language that you can show. So different body language relates different types of message. Position, macam saya cakap tadi, you don't go opposite to the patient, you go by their side, because it relays the effect that you are with them, you are not against them. And then the ambience of the session. So ambience of the session tu maknanya kalau sedih, ambience dia kena sedih lah. Kan? Kalau happy, ambience dia kena happy punya ambience. And then touching, you cakap benda sedih, touch, sentuh bahu dia, for example. So because touching ni is very important. Sometimes you nak relay something important information, you cakap, you touch. You cakap, you touch. So it enforces the message into their subconscious mind. Kan? So touching is sometimes important. Cuma kena remember lah, sometimes different gender ni will be a bit of a problem. Okay, and then mirroring. So mirroring ni maknanya sometimes for you to get into their subconscious mind, you need to mirror them. So mirror how? Mirror the tone of their voice. Mirror the body language. Kalau dia duduk, you duduk as well. Tak okay kalau dia duduk, you berdiri. So it doesn't gel, it doesn't mirror. Bila it doesn't mirror, it doesn't go into their subconscious mind. So mirror the body language. Kalau dia tak tangan atas meja, tangan pun tak atas meja, for example. So mirroring is a very powerful technique actually. It helps them to understand, it gets into the subconscious mind. And then this is another element of communication that has been banyak paper pun pasal ni. Bila you interview a patient, bila you have communication setting with your patient, among the technique is a spikes technique. So spikes technique ni apa? Spikes technique ni S is setting up the interview. As I said before, the setting must be proper. You need to mentally rehearse the plan. So mentally plan, okay, you nak cakap ni, lepas ni. So rehearse mentally. And then arrange for privacy. Sit down, better sit down and use open body language. This is the setting up the interview. And then P for perception. So elicit the patient's perspective. Assess the prior understanding. Assess what's the belief and feels. Ada benda yang effect dia punya belief dia tak, culture dia tak, macam mana. Contoh a dying patient, Muslim, non-Muslim. So apa dia nak? Sometimes kalau non-Muslim dia nak baptism, for example. You should arrange untuk dia buat baptism for the child, for example. What does the belief? Assess vocabs and comprehension. What types of jargon you need to use? What sort of vocab? What is the level of vocab that you can use, for example? And then invitation. So ask the patient what they want to know. Apa lagi nak tahu? Apa yang nak daripada session kita ni? What do you want to know? What do you want to achieve from this session? So invite them to give what they want and obtain permission to share knowledge. If you want to share knowledge, if you want to partake, if you want to give information, ask them, can I share this with you? Do you want to know about this? So bila kita obtain permission to share the knowledge, it's subconsciously dia akan lebih menerima daripada you main bagi je. Faham? And then knowledge, provide info in small pieces. You tak boleh lambakkan bagi bom setengah jam, 1 jam cakap pasal banyak information. They won't get. Use simple language. Even you can use some jargon, but simple language. And then emotion, explore and explicitly, clearly recognize and give empathize. So show empathy to whatever their emotions. So appropriate empathy to their emotion. And then strategize and summarize. So strategize and summarize. Set out medical plan of action. Arrange for follow-up. So strategi kan betul. Okay, lepas ni nak buat apa? Lepas ni nak buat apa? Lepas ni nak buat apa? And then always give summary. Okay, kita dah discuss for 1 hour. This is the summary. Ini kita punya conclusion. Okay tak? Setuju tak? Assess that. Okay, ni kita dah ni. Mak setuju. Okay, ada nak tambah tak daripada ni? Ada tambah tak plan kita ni? So make sure that the plan is not our plan. It is the plan together with the patient as well. Yeah? So plan. And then always arrange for follow up. Nak kita boleh arrange temu janji akan datang. Boleh tak jumpa? Arrange for follow up. Call for help. So call for help ni always offer to discuss with seniors. In your case, kalau you dapat case DKA for example dalam you punya med or ski, you dapat case apa-apa, always offer, okay, mak faham tak? Mak rasa okay. Kita dah buat macam ni plan kita. Mak rasa okay ke? Mak nak jumpa dengan pakar bahagian respi. Nak jumpa dengan pakar bahagian ni. Nak perlu ke mak rasa untuk kita rujuk pada orang lain? Offer to discuss, offer to refer, offer to follow up. So always offer those things. Yeah? Offer for a multidisciplinary approach, for example, because you are not the best. You know already. Kita semua, no one is the best at everything. There is always someone better. Offer. Okay, nak ke kalau saya rujuk pada bahagian dietitian, for example. Nak ke saya rujuk kepada bahagian mata, bahagian apa dan sebagainya. So always offer for referral to someone else because there's always someone better than you in certain parts of management. So always offer to refer. Next, other aids. So other aids that you can use are things like visual aids. Kan? Charts ke, you nak kena charts, you nak kena draw. For example, you nak counsel parents, anak dia ada patent ductus arteriosus in failure, for example. You need to draw lah. Draw, lukis gambar jantung macam mana. Where is the ductus arteriosus? What happens bila ductus arteriosus is still open? So draw. So drawing can actually help in terms of to get better understanding of the problem. So always think about usage of other aids. So you need to remember, some people they are auditory. Some people like me, we are auditory. So we depend. I am better. I can understand things better when I listen to things. Close my eyes, I listen to things. Some people they are visual. Bila dia are visual ni dia nak kena tengok. Bila dia tengok tu dia remember better. Some people are digital. So digital tu dia nak kena tengok factual, nak kena tengok numbers. Bila tengok numbers dia remember better. Some people are kinesthetic, dia nak kena touchy feely ni. So people are different according to their some people they have different affinity to certain elements. So but anyway, using visual aids, using charts and drawing, it may help for you to actually relay your information and actually help the patient, the parents to actually understand and formulate further plan. Kita buat summary pun sama. Buat summary, you tulis summary tu. Okay, summary kita ni. Agree, faham, sign. You sign, parent pun sign. Kan? Baru settle. Kurang medical legal. Parent tak boleh cakap dalam court nanti, masuk court disaman kata doktor tak cakap pula benda ni. Padahal sebab tu kita kena sign. Dia tak ada sign. So, kita dah bagi tahu dia buat surgery ni, this is the complication. Sign. Baru dalam court tak ada jadi isu. Okay. Alright. I think that's all. Communication. Clear tak? Boleh. So sama juga. Even you nak clerk patient, nak dapat history pun sama. Always the same thing. So introduction, get consent, explain the role of everyone in the room, kan? And then you use appropriate language, appropriate emotion, appropriate empathy, get conclusion, assess understanding, assess the role and so on and so forth. Okay, any question? Clear? Boleh buat? remember, always at every level assess understanding, assess level of understanding, and make conclusion, make summary. Okay, alright. Ada apa-apa?
InsyaAllah Doktor.
Tak ada, clear.
Doktor, macam mana nak panggil parents punya patients tu, macam how to address them, macam as puan ke, macam doktor sebut mak tu ke, ataupun macam mana? Macam cara.
So it depends lah. It depends on it depends on the setting. So some people we use apa nama I think in Malaysia most of the time we use mother lah. Mak, sebab mak pada baby tu kan. So sometimes we use mak. Sometimes we use puan. I don't quite agree with usage of term macam abang, pakcik. So I don't agree with that. Faham tak? Kita panggil semua orang makcik atau pakcik. I don't agree with that. I think the better term would be if the parents tu is mother kan, ayah dia kan. So kita boleh guna mak dia ataupun ayah dia. Ataupun kita guna encik lah, encik. I think encik puan will be a more professional punya term. I know banyak doktor kat Malaysia dia still guna, dia panggil kakak, makcik apa semua. I don't think that's appropriate. I don't think that's appropriate. Okay. Macam mana?
Lepas tu doktor, kan doktor tadi kata tadi offer to discuss ataupun refer atau follow up tu kan. Kalau macam bila kita dah cakap kat patient macam tu, lepas tu patient tu tanya balik kita macam doktor rasa macam mana? Perlu ke saya jumpa ni? So kita nak jawab apa?
So so first thing, bila you offer, you must have a purpose lah. You tak boleh offer just for the sake of offering. You tak boleh offer just to stop. Dr. Syed kata kena offer. No, that's not appropriate lah. So you need to offer bila you ada plan. Maknanya, okay, kalau patient nak refer, so first, what is your preference? Do you prefer the patient to be referred or not? So you need to say lah. So kalau you personally, you think it is good if it is good for the child to be referred, then you say, I think the child should be referred. For example. Ataupun you boleh kata, okay, I think you nak refer pun boleh, tapi kalau tak nak pun saya rasa tak apa. Kalau yang penting, apa yang mak faham. Contohnya. You want to discuss about diet, for example kan. So you nak discuss about diet kan. You think the parents has a good understanding about dia punya diet. So you think don't need refer. You can offer, but you can say lah, okay, saya rasa kalau yang penting mak ayah faham. Kalau mak ayah faham tak perlu jumpa pun tak apa. Tapi kalau nak jumpa kita boleh rujuk. Macam tu. You explain lah what's the pros and cons of getting referral. So sometimes tak guna you bagi referral, tapi nak jumpa untuk that referral tu takes 3 months. For example. Kan? So macam tu. But you need to always give them the option to be referred. Okay.
Assalamualaikum Doktor, saya ada soalan. As a medical student kan, lepas kita dah clerk satu patient tu, dah tanya history semua, dah buat physical examination semua, kalau si parent tanya kita apa keadaan anak dia atau tanya kita lah apa pendapat kita tentang anak dia, kita layak ke untuk bagi DDX atau apa pendapat kita tentang anak dia tu, sebab takut bercanggah dengan doktor yang betul punya itu kan. As a medical student, kita layak ke bagi opinion kita?
I think it's okay. No, the thing is you need to know your level. So it's not just about medical student. At every level of your life, there will always be a situation where you are not actually appropriate to give the. So you need okay. For example, I'm a neonatologist. Kan, if I have a patient with with diabetic ketoacidosis for example, and then patient pula tanya pasal benda-benda yang very endocrine punya issues, I cannot give the judgment. I cannot give, okay, I cannot give the final verdict. Sama juga dengan patient, kalau patient datang dengan cardiac punya problem, kan? I cannot clearly say, okay, saya rasa mak ni kena buat surgery. Confirm kena buat surgery. Confirm kena buat closure of PDA. I cannot because I'm not the expert. Because the expert will be there will be a particular expert at that particular time. And so I cannot give everything. I can only give things that are appropriate to my specialty. So sama juga medical student, nanti WHO, lepas tu medical officer, kan? What you can do is what is within your circle of influence. So your circle of influence, so at your level, what you can do is you are just doing detective works. So you can say, okay, apa yang daripada mak cakap ni, kita beritahulah terus terang, I'm not a doctor yet, I'm training to become a doctor. So, but from what I gather, sounds like this. I think this, but I'm not a qualified doctor yet. I think this information should be relayed by who and who. Macam tu. Faham? You tak boleh kata bila parents tanya cakap, alamak, minta maaf lah mak saya belum doktor lagi, saya tak tahu. Tak boleh, no. That's not appropriate as well, kan? So, but you cannot confidently, mak ni kena ni, tak boleh juga. Faham tak? So you can say lah, but first you acknowledge your level. Even at my level, saya neonatologist, saya tak bidang ni bukan bidang kepakaran saya. Saya pakar kanak-kanak tapi kepakaran saya bidang neonatologi. Yang ni dia ada pakar dia. Tapi daripada apa yang saya faham macam ni. Tapi untuk dapat confirmation kena jumpa pakar yang spesifik bahagian dia. Faham? So we acknowledge what are our weaknesses. Okay, boleh?
Boleh. Terima kasih.
Doktor,
Yes.
What to do with parent yang refuse treatment for their children? Macam contoh bomoh tadi. How do we convince them? Or
It depends lah. Some people they have fixed false belief. Macam anti-vaxxers. I think there's no role for you to, we still need to educate them, but don't fret too much about it. Kalau dia dah refuse, dia refuse. It's okay. It's alright. But not in every sense. Contohnya macam baby saya tadi kan, the baby that needs surgery. Without surgery, baby cannot live. So this is a life and death issue. So we have several ways to go about it. For example, what we did with that particular child was, ada sekali tu bapak dia busy. Ada 2 minggu yang bapak dia memang tak boleh datang sebab bapak dia kena pergi Thailand apa semua. So mother actually agrees with us. Tapi mother takutlah sebab bapak dia quite abusive sikit. Kan? So but in that particular window, 2 minggu tu we did the surgery. So by the time bapak dia datang balik, baby tu has already undergone the surgery. Or we can, if it's a life and death matter, we can use our power. We can use because under Child's Act, parents tak boleh buat benda yang against child punya health. Something that is life threatening, there is no choice. Parents tak boleh make the decision. So kita boleh use that power. Kita boleh call child protector. Kita boleh call bahagian social, bahagian kebajikan. Kita boleh use our power. Signed by the kebajikan, signed by 2 specialists for example. Kita boleh buat benda. So because under Child's Act, all these things are, contohnya macam parents yang nak AOR discharge at own risk. Baby tak okay lagi nak discharge. Kan? Actually tak semua kes kita boleh allow AOR discharge walaupun parents nak sign. If it has a risk to the child's health, or if there's a risk for the child's life, we cannot allow AOR discharge. It is under the law, Child's Act. Okay, right. I have another meeting. I think if you have any other questions, nanti kita boleh discuss balik lah. Okay, all right. So we'll meet again on Friday. Okay, let's end our session with tasbih kafarah surah. Okay, assalamualaikum.
Terima kasih, Doktor.
Thank you, Dr.
Waalaikumsalam.
Salam.
Doktor.
Doktor.